Pat. Good morning, everyone.
Good morning.
Morning. Kayla, did you make me a co-host?
I will do that now.
Thank you.
Thank you for the reminder.
I'm having an issue with my computer, so I'm on my phone. Um, but now I'm trying to figure out how to silence. Oh, there we go. How to silence me.
You got it, Rhonda. Good job. Good morning, everyone. We still have quite a few people streaming in, so we're going to give it a few minutes before we kick off.
Good morning.
Morning, Molly.
Morning, everybody.
We'll give it one more minute and then we'll get started. We have a pretty packed agenda today, so keep us on time.
Welcome all. Sorry, I had not been on Zoom in a couple weeks and my computer wanted to do a little update to it, so sorry about that. Um, I hope you are all doing well. We'll give folks another 30 seconds or so to join. I thank you, Kaylee. Yes. I am on sabbatical, but I came back just for this one meeting, and otherwise I'm being good.
It better be just for this one meeting, Kathy.
It is.
Okay.
Um, and I'm very grateful for the chance for a break. Um, okay. Thank you all. Oh, Vanessa, I hope that you too are only doing the one. Um, so, um, sorry, I'm like more discombobulated than usual. Hold on one second. Oops. Okay, so um, for those who don't know me, my name is Kathy Cohen Del Rio. I use she, her pronouns. I'm the Advocacy and Programs Director for Maine Equal Justice and Chair of the MaineCare Advisory Committee. Um, Adam, our Vice Chair, is out on paternity leave right now. So it was a funny bit of timing in terms of when people were supposed to be out. But this felt like a really important meeting not to miss because um, we had this is 1 year since we've made a bunch of changes to the MAC due to a new rule from CMS around how these types of entities in every state need to operate. And it felt important to have a check-in about a bunch of things today. So thank you all for being here. And I hope that even for those who are not on vacation or leave or anything, that you get some opportunities to enjoy this beautiful Maine summer. Um, Kayla, I'm gonna pass it to you to do the breakout rooms for the introductions.
Great, thanks, Kathy. I'm going to open up the breakout rooms. It will automatically assign you to a room. We'll have about 4 to 5 folks to each room. Please go around in your room and introduce yourself, your role, what brings you to the MAC, and then something you're looking forward to this summer. I'm going to give us about 8 minutes and then call us back to the room to get started with our agenda. Go ahead and get those open for you.
Good morning, Jillian. Would you like to join our breakout group? We've just gone to breakout groups. Hi, Kayla. Sorry I was late getting on. My Zoom wanted an update this morning. Talk about inopportune timing.
Oh, no worries at all. Thank
I
you for
wonder,
joining. Appreciate
I
you being
wonder if it's related to the relicensing. I had a
perhaps.
few,
Yeah,
I
that
had a
is,
few heart-stopping moments. I'm like, oh my gosh.
I know. It's always the most inopportune times when it wants to reboot and update.
Oh, it's awful.
Yeah. Well, glad to have you here now, and thank you for your help in advance. We appreciate it.
Happy to help.
Jillian, I saw you come off mute. Are you having trouble with technology this morning, or is the breakout room not calling you in?
Can you hear me?
Yes.
I didn't get, oh, maybe right here. Sorry, I jumped in a little late. I'm still not getting the calendar invites on time. I'm just getting these like the night before.
Okay, it should be something that you can manually save to your calendar. Oh, she's gone. And Caleb, great to have you join us. Are you having any technology issues or is the breakout room not open for you?
Kayla, he just wrote in the chat that he's not able to unmute.
Oh, I see. Okay. All right, no worries, Caleb. Sorry you won't be able to participate in a breakout room.
Hi, Eliza. Welcome. We are in breakout groups right now, but we'll be resuming shortly.
Thank you so much. Sorry I joined late.
No worries at all.
Natalie, thank you for joining us. Folks are just in meet and greet breakout rooms before we get the meeting started. I'll be calling them back into the main room in about 1 minute.
Okay, sounds good. Thank you.
Thank you. Hi, Sarah. Glad you could make it today. We just have folks in the meet and greet breakout rooms, but I'm calling them back in just a couple seconds.
Kayla, meet and greet. Like networking. Sorry. I know.
Just the initial like introductions,
Okay.
connection
Okay.
point. Yeah.
Well, there it is. I haven't read the email that, with the agenda. So I thought, oh shoot, was there homework? Okay.
Oh, no, no worries. No
Okay.
homework
I'll
today.
just wait. Okay, thanks.
All right, I'm going to go ahead and call folks back in. Hi, everyone. Welcome back. Thank you for participating in our connection point. We will have a survey at the end of the meeting, as we've been doing for the past year or so, where you can provide feedback on that activity. We'd love to hear from you. Looks like we lost a couple folks in the transition. Kathy is rejoining right now.
I just admitted Kathy. I'm wondering if she got kicked out. Somehow it says she's joining.
Thanks, Sarah. Yeah, she might be having trouble rejoining.
She was in my group and said she was having internet problems.
Okay. Okay, if we can't get Kathy back in here, I can move us along with the agenda. I'm not seeing her.
I
I
just
will
got
go
back.
ahead.
Are
Oh,
you looking
great.
for me?
Perfect. Yes, yes, thank
Sorry.
you. Perfect.
My internet like dropped me as I was trying to come back. Um, Thank you all. Okay, so let's go ahead and move forward with our next agenda item, which is updates. And I know many people are interested in these updates from the Office of Family Independence, OFI. I'm not sure if I saw Ian or if it's Vanessa or someone else giving those updates.
Jess is here. Jessica
Yeah,
Grant.
hey, Kathy.
Oh, I'm sorry,
Hi.
Jessica. I didn't see you either.
It's okay. It's me. Yeah, Ian is out this week, and I am going to cover just some quick updates from OFI. If we're ready to do that now, I'll jump in. I think we wanted to talk just like quickly about some of our overall like operational performance and kind of how we've been doing lately, if that's helpful. Um, for applications over the past 5 weeks, OFI staff have, continued to kind of maintain our productivity and managing some increased workloads due to less processing hours. We've had a couple of weeks with 2 4-day work weeks in the past couple of weeks, and that makes it, a little bit harder. And there's also been a rise in reported changes from households, which is like good. It's just kind of those typical changes that you see. We appreciate like the continued efforts of our staff to kind of balance day to day while just also prepping and getting ready for a lot of upcoming program changes that we've had to provide training on and that we'll have to continue providing training on. Our call center performance has remained relatively stable. So the current average wait times, it's about 15 minutes for the MaineCare only line and about 40 minutes for SNAP calls. And just as a reminder, households that receive both MaineCare and SNAP continue to use like the SNAP queue and so have that maybe higher wait time. But these are just averages and just we know that some individuals' experiences will vary depending on the time of the day and just general call volume, but those are the averages. A quick update for the TANF unit. So we are nearing completion of implementing kind of like a dedicated TANF unit within OFI. It's an internal operational change, and it was just to provide more focused staffing and resources for TANF administration, help to kind of improve consistency and support timely customer service. Consumers shouldn't see any changes, including like no changes to the phone numbers that they contact or going into offices and how they apply for or receive benefits. It's mostly just, again, internal to help with improving our ability to provide better customer service. We are getting ready and gearing up.
Jessica?
Oh, yep, go ahead.
Before you go on, can I just ask a quick question?
Sure.
If I appreciate all that OFI is doing to try to improve wait times and make sure that applications are being processed in a timely manner. We've continued to see people struggling with wait times, which seem very different than what the reports from OFI are. And I've heard this from other folks as well. Um, and then, and also, I know there's still been like challenges. Well, this is the MaineCare Advisory Committee. I know there's like been frustration by people who've submitted changes around like SNAP renewals and then them not getting processed in a timely manner. And I'm not sure how that impacts their MaineCare renewal. It seems like SNAP is the thing people complain about the most, but I'm assuming that if income changes or other household changes are being reported for SNAP, that they also apply to their MaineCare case if they have that. So I guess I'm just curious for people whose experience is different than what OFI is reporting, is there something that those of us who work with folks can do to help make sure you all know what people are experiencing that seems different than what the numbers sometimes show?
Yeah, I would say again, just like those open lines of communication. I think you guys have all of our kind of like program management contact information or Vanessa's contact information. And I do think it's like important for us to see sometimes when there are these like one-off cases and we're happy to like communicate about potential reasons like why some things are delayed versus not. Again, I think um like I said, I definitely was giving averages, but we do expect the majority to kind of fall into that range. And so like if we are seeing a lot of people outside that bell curve, like it would be good to like know it and to recognize it. So I do think like communicating that information to us is like always helpful. It's always good for us to like know and be aware of.
Okay, thank you.
Yeah. Um, and then yeah, it's a good lead into like just in general, like the program changes, which we'll talk about in a second too, and just like all the different changes. We are going into a significant like hiring initiative in the month of July and August. So over the next 6 months, OFI does plan to hire approximately 100 new eligibility specialists, which is about a 20% increase to our eligibility workforce. And it's intended to kind of help, strengthen the program administration, improve the processing timeliness, reduce SNAP payment errors, which, could have a large impact on us coming up, and also help support the implementation of the MaineCare work requirements as they're coming within the next year. I say it here just to say too, like it's good. I know a lot of you have contacts, and if there's anybody that you think would be interested in working for the state or having one of these jobs, I would encourage people to check out the maine.gov website. I can insert the link into the chat later too, just that there will be a large round of hiring for eligibility specialist positions. And then if we want to get into a little bit more about the federal kind of changes that are coming. So there is a lot of SNAP verification changes. So starting in July, and you'll have to bear with me because I am standing in for Ian and I do keep up with the SNAP things, but this is definitely not my expertise level. But we are going to start requiring documentation of shelter and utility expenses during SNAP applications, renewals, and reported changes. So the purpose of this change is to ensure eligible households get the correct SNAP benefit amount, reduce future overpayments and underpayments, and strengthen long-term program integrity. So by us verifying this information up front, we can help prevent situations where households later receive incorrect benefit amounts and may be required to repay benefits, which is a situation no one wants to find themselves in. These operational changes are also a key component of our strategy to kind of reduce our overall SNAP payment error rate in Maine. We're hopeful that this enhanced verification process will address several of the largest contributors that we have to the payment errors and continuing to ensure eligible households have the access to the benefits that they qualify for. The documents that we will require for SNAP upfront, shelter and utility expenses, is July 1, I believe. Let me see.
Yes,
I'm not
They
okay.
mentioned that in the Lewiston office yesterday. I was with somebody as a peer.
Yeah, and it did go through the rulemaking process too.
Thank you, Vanessa. The back. I'll give it a second in case there's more questions.
I see Kathy's question about which documents are required. So we're looking at like shelter and utility expenses in order for them to count in the budget. So if someone has a rent, providing either a rent receipt or some type of we're trying to use the word like documentation or proof instead of saying verification, but internally we say verification. So, and then a proof of income, which is something that we've required in most instances already, but just making sure that people know we need proof of their pays, like of their work as well. Yeah, shelter, it could be a lease as long as it's a current lease that verifies how much they're paying. If they're receiving a subsidy, if we want to see like proof of what the subsidy they're receiving is, if they're paying like 30% of their income towards it. If we have a rent to own agreement, we proof. Um, if it verifies what the shelter expense is, Rachel, then yes, it would need to like the if you're paying the expense to that person, it could be a statement that I so and so I'm receiving $1,000 a month for rent from Rachel. So sorry,
Okay,
Kathy,
I'm
I know
just
I'm
asking because my
facilitating.
husband just started a new job and I'm literally going this afternoon to update everything. So I want to make sure I actually walk in with what they're gonna need.
I think it's like proof of like payment, any kind of written statement that can be provided. We know that not everybody has like these agreements in place, like officially, but there's like proof of like every month I pay this $300 or whatever.
Oh, the guy that we have our rent to own has a whole spreadsheet and it's in a shared
Beautiful.
Google Doc, so I can just print it off. Like it's fine. I just wanted to make sure that was good enough and I didn't need to like go track anything else down.
I think that should do it.
I don't want to get too sidetracked with like all the details, but if there is any communication, and hopefully at some point there might be from OFI around what this looks like, that would be helpful to share out. I know it's SNAP related and not MaineCare specific, but I feel like it's helpful for a lot of folks on here to be able to support people with accessing.
We're sending out a letter. We're giving an extra pay, like some households are receiving a little extra money because of the standard utility allowance changes that were late to be implemented from October. So we're sending out a letter, a one-time letter with that information on the first page, and then on the second page, it's going to talk about the SNAP verifying expenses and giving examples of that, and encouraging people to provide the proof of expenses upfront with their application or renewal or their change. So there will be a letter going out later this month to folks, and we can make sure like a copy goes out when we start sending it, so that the partners are aware of what it says.
Thanks so much.
And to Kim's question, I did not say what the biggest contributors are to the SNAP payment error rate. I do know that we do know what they are within OFI. I personally don't know what they are within OFI. And I do know that the changes that we're making are to address them. I think that a lot of effort has been put into identifying what those things are so that we're not spending time or resources on things that would not help us decrease that payment error rate. And I think if we need to provide more details on that, we can probably next time, but I definitely am not the person you want to do that.
Yeah, this is not a detailed answer, but I do know that generally speaking, the error rate is related to or in order to reduce the error rate, OFI needs to have correct information from SNAP recipients sooner, right? So basically making sure that participants update OFI with changes to income, et cetera, as soon as they happen. I believe that is very important to the payment error rates, and that's part of the challenge.
Yeah, and I think Vanessa just threw it in the chat too, which is probably Look at us, MaineCare folks, doing the very best we can for this SNAP program. Okay. All right.
Will
Go
these
ahead.
rules transfer over to MaineCare as well?
So when someone reports something for SNAP, it's considered like a change of circumstance for MaineCare as well. So we will like take all of the information and factor it into both benefits if it does impact it. Things like their household expenses should not be impacting the MaineCare eligibility or benefits at all. But yes, it will be like reviewed as part of the whole kind of case review.
Okay. Just to let you know, I had a mom. I went in and as a peer and supported a mom yesterday, and her file has been sitting for a couple of months in the portal. And one of the things that was mentioned in the Lewiston office yesterday is probably because of the lack of this information. But nobody reached out to her. She didn't get a letter or an email or anything. So I hope folks that are in the portal are contacted somehow and know that they need to bring in this verification.
Yeah, I would agree with that sentiment. Then, like, yes, everybody who we are expecting something from should have been notified of that in one way or the other. Um, and again, happy to like look into these kind of like one-off things to ensure there's not like a systematic issue or something broader that we should be aware of.
Just for the record, I received no communication about it, and I called the 800 number to update my husband's employment status, and they had said nothing, and that was yesterday. So I don't know that this information is landing where it needs to, and we might want to check into that.
And I believe that there's just like a clarifying point too. It's not immediately that everybody should be verifying these changes. It's at application and renewal. So if you aren't due for a renewal, you wouldn't have been asked to verify this information outside of that. But if there is a change that you're reporting, you should still continue to report any changes. And then if it is specifically a change to a utility expense or a shelter expense, provide verification when the change is reported. But if someone doesn't do that, we would be asking for it in writing.
They stopped her at the screening window and said that they would not continue to receive her information until they had all the information and sent her home in Lewiston.
Yeah, I would be interested to follow up on that.
Yeah, so it would be great. Maybe you folks can follow up with Jessica or Vanessa. Well, Vanessa's out, so follow up with Jessica
I can
afterwards.
send an email over for the sake of timing because I know we have a lot to get through.
Yep. I'm happy if you guys want to shoot me an email
Yeah.
with some more detailed
Yeah,
information.
that's why I
Get it
asked the
to
question earlier for you, Jessica, and Vanessa as well, because about like people's experiences being different than because this type, particularly what both um of these back members just said, is what I keep hearing. I'm not even at work and I'm hearing it from people out in the community. So I think that like there is somehow a disconnect between people's experience and what the um numbers reflect and the communications reflect.
The same
So
thing with non-emergency transportation. There is definitely a
yeah,
discrepancy between complaint numbers and what's actually
yeah,
going on.
yeah,
I'm really happy to be able to give Roger direct information now.
yeah.
And
But maybe we can. Oh, go ahead.
Oh, I just do want to say that generally, I mean, I think it's always going to be the case, unfortunately, that what you hear about averages is not going to reflect everybody's experiences because, you know, there's going to be cases that are much worse, and also we're more likely, rightly so, not just as a department, but just broadly speaking, to hear about things that aren't going well. So I'm not trying to downplay seriousness of issues or that they have real obstacles for individuals, but shortfall of statistics generally is it's going to tell you about the average. And sometimes there are issues with calculations and numbers and ways, and so we absolutely need to recognize that. But it is generally helpful to see if things are trending in the right direction, and that doesn't mean that we're all good to go and everybody's fine. But it's important for us to recognize when we're moving in the right direction or moving in the wrong direction. And there will always still be cases that need additional help. And again, sometimes if there's actually an issue with calculations, etc., it's good for us to understand if there really seems to be a disconnect at a big level and not just a personal level.
Yeah, I don't disagree with anything you just said, Michelle. And I know we're talking about like hundreds of thousands of Mainers are interacting with OFI regularly, and a lot of these are individual cases. I do think we do see trends in terms of when things keep coming up, and I feel like there has been a consistent trend over the last couple months of people experiencing this particular problem. And so just um, because it's coming from multiple places, like not just one source. So that's what makes me feel like it's more of a trend, at least in my experience. Um, and so something for folks to be aware of. But I am also conscious of time. And so, Jessica, maybe if we can move on to the MaineCare changes and then we can do the updates from MaineCare staff.
Sure. So just I'll quickly just say that we did see some internal or interim final rule guidance received from CMS on June 1st of 2026. This was kind of CMS providing all states with the interim final rule on the work requirements that we are expected to implement for MaineCare. We are working hard to review this rule and evaluating all of the kind of next steps for July and our timeline and any change communication. So we're doing that work on our side and more will be coming on all of that. Also on Friday, June 26th, we did send a one-time MaineCare kind of early awareness letter as part of HR1 like law. Certain immigration statuses are required to shift from full MaineCare to emergency services only in October. So we sent out that early awareness letter to about 426 households, which was 627 individuals who may be impacted by those upcoming federal eligibility changes, and we expect to reduce their MaineCare coverage to emergency services only beginning in October of 2026. The letter is intended to just provide extra advance notice of those anticipated changes. Users that just use the portal, the My Connection accounts, also received the letter on Friday, June 26th, but others will be going in the mail and so might take a little bit longer. And we do have translated copies of the letter available in the top 6 languages spoken by the population at the regional offices. So the letter went out in English with our language insert that we insert into most letters and letting them know that if they needed it to come into the office, and then in the office, it is a very specific letter translated. And again, I see Alex's question. They did go on Friday the 26th, and so by mail, people should have gotten them or might still be getting them trickling in depending on the mail in their area. And again, it's a notice, but I think we should not necessarily say a notice. It's not, it is a letter of information to tell them that this is what we expect. And we think that this is where they will land, and to just kind of let them know that this is coming, early kind of awareness more so than anything else. People will be given more information as that time gets closer within the month of September if their eligibility is directly impacted, with potentially some additional information in between now and then as well.
Alex?
Sorry, Jessica, I just wanted to add something that Ian shared with me that I found really helpful about these changes is that they're all going into effect at the same time on October 1st. So unlike some of the changes to SNAP that we've been seeing that are confusing because they're staggered or they happen at a renewal or point of application, everyone who's impacted will lose their eligibility or be unable to enroll in MaineCare starting on October 1st, which is very unfortunate, but also, I think, clearer to communicate to people. So I found that helpful. So just wanted to share with everybody.
Thanks, Alex. And just for awareness, I'm going to talk some more about this topic as well and have some slides with additional information. So we might be able to hold for more discussion until we get to those. Nope, it's OFI and OMS work together,
Yeah.
but just I know that it's a very concerning topic, and I imagine there's lots of interest. So I just wanted to let people know that I'll be talking a bit more about it.
And just for Wanda, the SNAP changes are already in effect, and so people have been having their eligibility redetermined as they've gone through their redetermination process. If they're subject to losing their SNAP due to their immigrant status, then their immigration status, then those changes are happening, as Alex just said, on a staggered basis based on whenever they go through their renewal process. So it's a little different than what's happening with MaineCare.
Yeah. Thank you all for those contributions. And then just like lastly, while there is no currently like proposed eligibility rules out, we anticipate that we'll be initiating rulemaking later this month related to these federal changes on non-citizens. And so you'll see those proposed rules coming, and we'll share any additional information as that process moves forward. And that is all that I have for this morning.
Thanks, Jessica. Appreciate you, especially having to deal with some areas that are not your focus.
Appreciate the patience.
So with that, we'll pass it over to Michelle for updates from MaineCare.
Like Michelle might be frozen.
I think that maybe she is. Kayla, while we're waiting for Michelle, is there anything helpful for you to share in terms of like other communications that might be coming out from MaineCare around these changes?
I think what might be a great idea is moving to the Health Pass update. If
Oh, okay,
Molly
that makes sense.
is up for that change in agenda, and then we could do Michelle's updates after that.
That's a very good suggestion. Thank you.
Yep.
And is that Molly?
Yes.
Great.
Give me 1 second. Let me just bring my notes up. Hi, everyone. Molly Slotsnik, Chief Operating Officer for the Office of MaineCare Services. And this is a little bit of an update from a topic I have brought to this group in the past. We talked about it in May 2025, and then I talked about it again this past May 2026. And this is about the upcoming upgrade to MIMS, which is MaineCare's claims processing system. It's a major upgrade that we're undertaking, a 2-year project. A lot of work going into it, but it's going really well and on track. And as a reminder, this system upgrade is currently scheduled to go live in mid-October of this year, 2026. In my presentation in May, this past May, I talked about actions that trading partners will need to take to prepare to access our new MaineCare Partner Portal. So that's the new name for the portal that will replace what is today called the Health Pass online portal. So MaineCare Partner Portal, that's what we're going to call it. We think it's a better, snazzier name. And as a reminder, when I say trading partners, what we mean by that are providers, billing agents, health plans, clearinghouses, and business associates. So probably for this group, it's mostly providers, but it is a bit of a bigger umbrella than only providers. So in May, I talked about what some of that early action is that we need trading partners to take. And I wanted to repeat that request today and give you a little bit more detail on that. So first is, since June, we have been sending bi-weekly e-messages to ask folks who are administrators of trading partner accounts, and hopefully if you're an administrator or your colleagues are administrators, you or they know who they are, asking administrators of the trading partner accounts to make changes to the structure of your portal accounts. So that includes deduplicating emails, making sure that you are removing any inactive users. So we have a whole number of those actions. We've also been, so those e-messages have been going out to our general provider distribution list. We've also been sending targeted emails to administrators of certain accounts that we know have more changes that they need to make than others, to help make sure that those administrators see the messages and see what they need to do. So my request to you today is to please take action as soon as possible. Do not wait until October to get close to the go live date, or you risk having issues accessing the portal immediately after go live. What we are hoping to have happen is that folks take the actions they need to take well in advance of go live, so that on day 1 of the new system being available, people don't have any problems accessing the portal. So I'm going to pause for a moment and share in the chat the latest e-message that we sent on this. Again, we're sending them out every 2 weeks. Okay, so I've just put the latest e-message in the chat. If you have questions about how to go about doing the things that the e-message is asking you to do, again, this is really for administrators of trading partner accounts. You can reach out to provider services. You can also reach out to your provider relations specialist, and I will put both of those in the chat too. Provider services, provider relations specialists. And finally, for those of you on the call who represent provider associations, we would really appreciate if you can get the word out, get this message out to all of your membership. That would be super helpful for us to make sure that everybody who needs to take action sees the message, knows what they need to do, and then does that thing sooner rather than later. So that is all has to do with trading partner accounts. The other thing that I mentioned in May is that we are going to have training available for all trading partners. And I mentioned that it was going to be later this summer. So I now have dates that I can share with you. So the ask for you today is for you and your members and your colleagues is to just keep an eye out for the training registration announcements that will come out. So the training dates are going to be September 8th to September 22nd. That's a 2-week period. Training does not take 2 weeks, but it's going to be a 2-week window in which we are going to be holding the sessions. And each session, I think, will offer a few times so that folks can find a schedule that works for them. And we will also have, I believe, a couple sessions in there that are open Q&A sessions, aside from the formal training sessions. We are also then going to have a week of refresher training. So if you want to take it again, or if you missed it, you're on vacation, that's going to be the week of October 5th to October 9th. So that's the refresher training. And we also expect to, so I'm giving you these dates now, but we should be opening up training registration August 21st. So I know that's a long time from now, but we're not, this group is not meeting again until after this kind of all happens or starts to happen. So you won't get the messages to say, okay, now you can register for training until towards the end of August. So I just wanted to give you that heads up now. So you have it in the back of your minds to keep an eye out for it. And I see, are you able to summarize the main changes to the partner portal that we will notice, or does that come during the training? That will definitely come during the training for sure. The training will talk about what are the changes, how to navigate the changes, what you would expect to see as a trading partner. I would have to pull up the presentation I did in May to otherwise do some summary.
Molly.
I'm sorry?
I can share that after this meeting with folks.
Oh, thank you. Thank you, Caleb. But yeah, definitely that's what the training is going to cover. What you need to know about the new portal will all be, as well as how to log in for the first time. What are some of the login changes between the current version and the new version? So that will definitely all happen during training as well. Other questions?
Thank you, Molly.
Okay, thank you.
All right, let's try this again. Michelle, are you able to do your updates now?
I hope so. I switched to my phone because my computer disconnected me 3 times from the meeting. So hopefully this will go a little bit more smoothly. So good morning, everyone. Thanks for being here. My name is Michelle Probert. I use she, her pronouns. I'm director for MaineCare. I have a lot of updates this morning. I did want to somewhat correct myself. I am going to be talking more about the non-citizen changes, but that's actually that's part of the breakout session, not for the whole group. But we can make that information available afterwards. So if you would like to discuss that topic more during this meeting, then feel free to join that breakout. I will start. Jessica Drenning mentioned that CMS did issue the interim final rule for work requirements on June 3rd. I think that there was a lot of hope and anticipation that all of our questions would be answered and there would be clarity so that we could start clearly communicating and partnering with all of you to make sure we're properly getting the word out. Unfortunately, in particular, in regards to what HR1 coined as medical frailty, which is one of the big ways that Medicaid members would be able to be accepted or excluded from work requirements. The interim final rule introduced more uncertainty and questions around what individuals would be able to meet that medical frailty criteria. And in particular, the interim final rule added something that had not been called out in statute, which ties somebody's ability to meet the medical frailty criteria to their ability to work. That goes side by side with a requirement in statute that states need to be pulling as much data as they can automatically to figure out whether individuals meet work requirements already or meet these sorts of exclusion criteria to basically minimize the paperwork and work that individuals and members themselves have to do to get through this process. That has unfortunately delayed some of our plans for communications because there are rightly many questions that at this point we cannot answer with a lot of clarity, in particular in regards to medical frailty. CMS, Centers for Medicare and Medicaid Services, have been saying that they're going to issue additional guidance and examples to states. We are still over a month later awaiting that additional guidance. We have not seen it yet. We are committed and planning to begin talking more openly about what we do know for certain as soon as possible, but we're going to have to recognize that there are questions that we don't have the answers to, and they are important questions. But we have decided as a department that we don't want to sit any not that we've just been sitting, but we don't that even though we don't have all the answers and it may be frustrating, we are going to start communicating more actively for what we do know, because otherwise we're going to fall behind. Important update regarding the interim final rule. You may have heard, my time is all confused. I think it was last week, but it could have been the week before. We, as the state of Maine, we have joined 25 other states in a multi-state lawsuit regarding the interim final rule around work requirements. Because of our concerns that some of the additions to the interim final rule did not align with the statute that was passed at the federal level. We are, at the same time that we believe that that is correct and we want to push back on some of these changes, on the other hand, we have to still work towards implementation on the same timeline as we have been. Because if our lawsuit is not successful, then we will be in a position where we are not able to implement, or we might not know yet if the lawsuit is successful before we are expected to implement. So we are both challenging the final rule at the same time as we are working very hard, and OFI is the lead on many or on much of that work to be able to implement this per federal requirements. I'm just going through my notes to see what I have missed. So just as a high-level reminder for everybody, work requirements, sometimes also referred to as community engagement requirements, these do start going into effect in January of 2027. They impact or have the potential to impact adults ages 19 to 64 who are enrolled through expansion. I wanted to note also, because this just came up with SNAP and the non-citizens, generally speaking, it is standard practice for eligibility changes at a federal level to be rolled out at individuals' renewal dates. And while that can be more confusing from a communication perspective, it helps both kind of spread out the impact, both from a member perspective as well as from a workload perspective. And so with work requirements, it is the same. Individuals who are subject to the requirements will come subject to those requirements at their first date of renewal. So for some people, that will not happen until the end of 2027, if, for example, they have a regular December renewal date. So just for awareness on that fact, what is happening with the non-citizen changes is an anomaly. And while it is easier to communicate, it also means that that's going to be a shock to the impacted population and to the systems that serve those populations all at once. I will also note that as part of the lawsuit, we call out the fact that federal requirements under H.R. 1 do require that states send a notice by the end of August to Medicaid members about how work requirements will be implemented in January 2027. And we have very real concerns about our ability to communicate that by August 31st, given the amount of uncertainty right now, especially around the medical frailty issue. And I generally wouldn't use the term medical frailty. It's a weird phrase that is the term that is used in statute. But at a very high level, it basically indicates individuals with serious medical conditions is what they're getting to with the phrase medical frailty. And we have, along with the 25 other states, we are asking the court to rule on their motion for a preliminary injunction by July 31st. I am not a lawyer, but I will basically say that we want there to be at least an initial stop by July 31st, is what we're asking the courts to do, so we can push back deadlines and continue and suspend the challenged elements in this interim final rule as litigation goes forward. But there's not a decision on that yet, so that is still to be determined as well. So again, on one hand, we are challenging this. On the other hand, we have to continue assuming with the assumption or with the goal that we still need to be ready on January 1 to implement. And we are going to be more actively communicating what we do know for certain and calling out what is still up in the air going forward. We're having meetings this week to try to nail down for example, when specifically we'll be having partner webinars, but my hope would be that that happens this summer. I also wanted to call out, and this is true for SNAP, it's true for the non-citizen changes. One of the most important things that we can ask from all of you for help and from members is to keep your contact information up to date. And also to check your email if you get messages through the portal, check your actual mail. We know that there are lots of reasons why contact information changes and members need to move. I am personally very bad at staying on top of my personal email and also sometimes my work email because there's way too much. But especially this coming year when there are so many changes that can have big impacts on individuals' lives, please make sure that you help us in spreading the message to update your contact information and be checking mail or email, including junk mail folders, to make sure that you're not missing any information. All right, I will pause for a moment to see if there are questions about the lawsuit.
Michelle, in terms of communication, I guess I'm thinking I remember this coming up last year when HR1 passed about confusion that some providers had around what that could mean if someone is undergoing treatment that doesn't resolve in like one appointment. I believe we talked about this in the dental subcommittee, for example, and how they should plan for like what happens if someone loses their MaineCare because of the work requirements or their immigrant eligibility in the middle of a treatment plan. Like we don't want people to like be pre preemptively denied getting care from their provider that they need, but also recognize that in some cases, if they don't complete the treatment, then the provider doesn't ever get paid. So just curious, like what kind of outreach you all are thinking about for providers or for members around those kinds of stickier challenges.
Sure, that's a great point, Kathy. And I believe in the letter that went out to the individuals who we at this point are expecting may well lose their coverage for October 1st. I mean, we do mention, on one hand, we want people to continue getting their care now, preventive care, screenings, and there may be certain important procedures or treatment that is absolutely appropriate and probably even more urgent to do now rather than wait. However, it is not likely the time to start on a course of treatment or intervention that means you're going to get halfway through or less and then be in a really bad position. And so we've indicated that, you need to basically individuals need to talk to their provider. And that's why it's important that we wanted to send out the notice that we just did. We're going to be sending out another interim communication. And that's why the federal HR1 statute does require states to start this communication by the end of August, because we do recognize that it will impact people's plans for their healthcare. Or it may, we know that it will impact some people's healthcare, right? And so we want people to be aware and to be having those conversations with their providers and with their families to figure out what course of action makes the most sense for them.
Thank you.
Okay, I still have a fair number of other updates, so I'm going to keep going. All right, so some of you may remember from a few years ago that MaineCare took the federally required step of denying medical claims when the provider was not enrolled in MaineCare. And it is also a federal requirement to do the same thing when a prescriber of a prescription is not enrolled in MaineCare. So the federal requirement is that Medicaid programs cannot pay for prescriptions when the prescriptions are written by providers not enrolled in Medicaid. We are behind in complying with this requirement. Some of that has to do with some systems issues, but also we have wanted to make sure that we are really on top of who, to the extent that we can be, who are these providers and how can we best have an outreach plan to get as many of them to enroll as possible so that we can minimize provider impact before we start taking measures to deny payment for those medications. And it's been a bit more challenging just because pharmacy data is harder than medical claims data for getting all the contact information, et cetera. So we've been doing a lot of work and collaboration and merging data sets so that we can really understand who these providers are and how we can best reach them. So this is another request for help from you all, that if you are aware of members who, and we understand that some individuals make the choice to receive some care that is not covered by MaineCare, but may result in a prescription that is covered by MaineCare. But we need to have providers enrolled in MaineCare even if they're not planning on getting paid, in order for us to then pay for that prescription. So for those of you who know providers that are not enrolled but that are writing prescriptions, they need to enroll in order for us to continue to pay them. We are, as I said, finalizing our data analysis and outreach plan, and within the next number of months, our first step is that we're going to start denying prior authorization requests for prescriptions where the provider on the prescription is not enrolled. And so we recognize again that this can definitely have big member impact. And so we want to do the best and most targeted outreach that we can to get the number of potentially impacted members down and the number of enrolled providers up before we start denying claims. But that is something that is going to need to happen in the future. Again, we are already behind on this federal requirement.
Michelle, can I ask a quick question about that? I want to make sure I heard you correctly. So I'm thinking about, for example, a MaineCare member who sees someone for mental health services and has to pay out of pocket for those appointments because they don't accept MaineCare, but they get medication for the mental health needs because of that. I think I heard you say that they need to be enrolled so the person can get prescribed, which I understand. But at that point, then would they no longer be able to pay out of pocket to see that provider? So, like, if a provider enrolls in MaineCare, then don't they have to accept them as a MaineCare patient? Because we can't require providers aren't allowed to charge MaineCare patients, right? If they're enrolled in MaineCare.
Yeah, that's a great question, Kathy. And there is a specific kind of enrollment for providers that are not going to get paid, if that makes sense. So it is, for one, it's a shorter enrollment process. So we're hoping that will ease the burden on a provider who, again, is not planning on accepting MaineCare. But basically, and it's too bad that Molly left because I'm forgetting like what we specifically call those providers. Is it
the NOPR, N-O-P-R, non-ordering, prescribing, rendering, or something.
Okay, thank you for spelling that out because I say NOPR all the time, but I could not remember what it stands for. So non-ordering, prescribing, rendering, is that the R?
No. I believe it's rendering.
Rendering, yeah. Okay, yeah. Yes, so there is a special enrollment for those providers where, again, they're not going to be receiving reimbursement, and so they can charge for those individuals, but this would enable them or enable us to continue to pay for the prescriptions.
That's super helpful to know because for those of us who are not providers but might have people asking us questions about what their provider can do, that's helpful for us to know that there's a different category.
Yeah, and we are planning targeted communications to different, for example, provider associations and some of our sister offices for different groups of providers where we see this as being more of an issue. And I will also note that, again, part of this is a systems issue on our end. So, for example, we know that there are some pharmacists who issue prescriptions, vaccines, et cetera, and there's a system limitation with us right now that means those pharmacists can't enroll as providers. So we're not going to be denying claims or prior authorizations where we don't yet have a pathway for a provider to be able to enroll, but where there is already a pathway and where we have conducted the outreach, and then we are going to start denying those PAs as a first step. And we'll communicate more, like precisely when we've determined when that is going to happen, et cetera. And as I started to say, we'll be reaching out to associations to say, like, for example, this is how many dentists that we're seeing, or this is how many nurse practitioners and PAs we're seeing in office settings, like information like that. And thanks to folks in the chat who spelled out NOPR and what the official status is for these providers. Okay, I'm going to move off that topic on the program integrity front. And if you have been listening to the news around Medicaid, there's still a lot of interest in prevention of fraud, waste, and abuse. One thing I talked about last time is CMS asked all states to submit provider revalidation, which is basically renewing provider enrollment. CMS asked all states to provide a 2-year plan for revalidating their high risk, with a focus on their high risk providers. Providers are all already required to do revalidation every 5 years, but this is a sort of an extra ask or directive really from CMS for states to have a plan specific to their high-risk providers. CMS has indicated that they are reviewing all states' plans and plan to give substantive feedback to states. We have not heard anything yet from CMS on our plan, and frankly haven't heard about other states hearing back from CMS yet. But CMS did also indicate that they do expect states to take action immediately and not wait for their feedback on these 2-year plans, because there's a lot to accomplish within those 2 years. So we are starting this month by issuing 30-day advance written notice to providers who will need to go through revalidation as part of Maine's plan. Kayla is linking to Maine's revalidation plan as it currently stands. Again, it could change with CMS feedback. But we have identified 2 cohorts that will get written notification of these plans this month. First, individual high-risk providers and providers without an NPI. I think NPI stands for National Provider Index. It's basically a special provider number. And that applies to providers currently categorized as high risk in the system. And those who do not have an NPI. The second cohort includes personal care providers, home health, hospice, and that also includes assisted living services providers. So again, plan is available online, and those communications will be going out this month. So that again applied, those revalidation plans were a directive to all states. Specific to Maine, we did get a communication from CMS, followed by an audit entrance conference, that the CMS Center for Program Integrity is conducting an audit specific to the state of Maine that is looking at our compliance with program integrity requirements from a national standpoint. And also looking at our provider enrollment system. CMS, so we had that entrance conference with CMS almost a month ago. Sorry, my screen just shut off with my notes on it. There we go. And so CMS has indicated that they are focusing on certain services. Those include interpreter services, psychosocial rehabilitation, rehabilitative and community support services for children with autism, personal care services, and residential habilitation. CMS has not defined these service areas for us. We have asked specifically that they provide us at a code level which specific services they're looking at, because these are not terms that we necessarily use regularly, and we do not know for many of them exactly what CMS is using as a definition. CMS has said that they will share the specific codes and definitions with us. We do not have that yet. So we're operating a little blind in that regard. So there's 2 components to this audit. One is from a program oversight perspective that will apply to all of the services I just listed. For personal care services, there's also going to be a claims audit perspective. And so CMS would be asking for information directly from providers for those services. Again, there are lots of different definitions of personal care services out there. We do not yet have the detail about what specific services CMS will be focusing on, but we will be communicating. And I will just say that it is in everyone's best interest, and we will be stressing communications to providers so that they know that they will be getting outreach directly
from the Center for Program Integrity or their vendors to share, for example, documentation for claims, et cetera. And it is in everyone's best interest for providers to share that information in a timely manner. Because if you don't share it, even if they just asked you once, they're going to say that this is an improper payment. And there could be a threat of recoupment resulting from that. Okay. Brief update on our so moving off the federal front for the moment, a brief update on our lifespan waiver. I just wanted to confirm that ODES and MaineCare are on track to submit the waiver to CMS this summer. We did get feedback and we heard you that the stated January 1, 2027 implementation date felt too soon. So we have pushed that date out to May 1st, 2027. And there is going to be a tour across the state of over 5 days for in-person presentations and discussion, further discussion about the lifespan waiver. All right, another update. So there was a law that passed this that expands Maine CDC's Maine immunization program. It historically has just applied to kids, but going forward, the Maine immunization program is going to include adults ages 19 to 64 as well. So for MaineCare providers, this means that after July 1, providers can order state-supplied vaccine for adults who have MaineCare coverage through MIP, the Maine Immunization Program, at no cost to the provider. So this is a benefit to providers, and the provider would, or for providers who are not currently going through the MIP program, they would continue to submit claims for reimbursement to us. And we are anticipating that eventually this will become a requirement to use the MIP program, but we know that providers have vaccine supplies that are existing to get through first, and we have some system changes we need to put in place, so we'll be communicating in the future about when this will become required. And Maine CDC has been taking the lead on messaging, and they have a webpage that provides more detail on the program. And then two better news, good news updates to close out my updates. One is that as of the payment cycle on July 1st, the department is no longer temporarily withholding any payments due to the MaineCare shortfall. And the payments that had been withheld with some very small exceptions that relate to some claiming issues that we're working through have gone out. And we have not heard in any substantive manner about member impact, et cetera. And so count that as a positive way to get through a difficult situation. Lastly, I did want to highlight that as of July 1st, as planned, MaineCare, one of our current brokers for non-emergency transportation, they expanded their services to take over the Mid-Coast region as a result of RFP. That RFP was challenged. The challenges did not hold up in multiple rounds of court and appeals. The Mid-Coast region includes Waldo, Knox, Lincoln, and Sagadahoc, as well as the towns of Brunswick and Harpswell. So providers now should be scheduling plans for this region going through MaineCare and the TripCare platform. And there's a flyer available to help educate providers. So far, knock on wood, the transition has been going smoothly. Waldo Cap has been working closely with MaineCare around that transition. And my understanding is that many of the Waldo Cap transportation providers have been enrolling with MaineCare so that those trips will continue. Woo! All right, I think that's it for me. Thank you.
Thank you for that, Michelle. That was a lot to take in. Any last questions? Um, also just want to lift up Rachel's comment in the chat around concerns around ongoing issues around non-emergency transportation and whether this will make it harder. And I know that's a topic we've talked about here several times over the past, but also maybe um, something we can plan to check in on after this expansion goes into effect. Great, thank you all. So up next is and I know we're a little behind, but we'll this next part will be shorter than on the agenda. Thank you, Kayla. I just wanted to flag that when I sent out the information for this meeting, I included a draft copy of the annual report we now need to do to CMS as part of that rule change I mentioned at the top of the meeting. So there are certain things that have to be included in the annual report. So we put that together, including agenda topics that have been discussed, subcommittee information, member lists, etc., and also a bunch of information that came from the back. And we'll hear more from the back in a minute about what they've been working on. If I have not heard any suggested changes to that report, I do just want to flag, and Kayla, I guess this is more for you, that Laura Cortez, who couldn't be here this morning at the last minute, noticed that the attachment for the recommendations that came from the rates subcommittee didn't get included in the final report. And I could follow up with you afterwards, but I had sent it with my draft of the report. So just wanting to make sure that that gets included because recommendations from subcommittees are supposed to be included. And then, and if anybody does have any final thoughts, if you could send them today, I'm going to check my email one more time later today to finalize this. And then I'll be back off again. So if you have any changes, let us know ASAP. And then that will get submitted and posted. I think it has to be posted online. I'm not sure now. But Kayla, do you remember? Are we posting this online or is it just getting submitted to CMS?
We sure are tomorrow.
Great, thank you. Any questions about that? I also just wanted one housekeeping note to flag, and this came up in several previous meetings, but Laura Cortez has been the chair of the rate subcommittee for the past 4 years, and is no longer going to be serving as chair of the rate subcommittee, and we still have not had anyone volunteer to take on that role. So if you are a member of the rates subcommittee or someone who's interested in the rates systems process and would like to be chair of that committee, please reach out. Laura has offered to connect with anyone who's interested in that role to help them understand what she's been doing in that role for the last while. It does have to be someone who's a member of the MAC that would be the chair. You don't have to be a member to be you don't have to be a MAC member to be a member of a subcommittee, but you do need to be a MAC member to be a chair of a subcommittee. And I'll also just flag again that we did used to have a provider subcommittee that focused on provider issues that we used to spend more time on. And today we talked more about provider stuff than usual, but we used to spend a lot more time on them in these meetings, but shifted that to a subcommittee. And we have not yet had anyone step up to take on that role either. So there's two opportunities if you'd like to become engaged in one of those subcommittees as a chair, please let me know. And we'd be happy to have you. I think that was all I was going to say about housekeeping. So now I'll pass it over to Rhonda, who's going to share the updates from the back.
Great. Well, interestingly, a lot of the stuff that we talked about at the back meeting last month on June 2nd has also been discussed previous to this. So, okay, so it was June 2nd that we met. I think there were 10 or 11. I don't really have the number present at the meeting, on the Zoom meeting. One of the things was we discussed MaineCare rulemaking and updates on covered MaineCare services. We also talked about how we reviewed the rulemaking process. So there's like 7 steps in making rules associated to MaineCare services that are covered. The first step is someone writes the rules. The rules are reviewed by MaineCare services. Then there's a proposal. There's a public hearing with public comments allowed. Attorney General conducts a review of it. Then the Department of Health and Human Services Commissioner adopts the rules. And the 7th step is the Maine Secretary of State accepts the adopted rules. So quite a process in looking at what's covered for MaineCare services. One of the other things was how can we make MaineCare rulemaking process easier for recipients or people that are involved with the MaineCare process? How can we make it easier for one to understand what those rules are? And some of the things we talked about was more phone chat access with someone who knows specifically the updated rules and changes. So not just, a call in to the Office of Family Information, but specifically having a number to someone who can really review with the person and maybe even a physician what those rules and changes are. Also, to create a quick hand guide with basic information for people. So if you didn't want to do the phone chat, you could have something very basic in handwriting, like a 1-pager, quick review. We're in the process of updating the MaineCare handbook. Several members of the BAC committee reviewed pages 2 to 18, as was requested to be done prior to the meeting, and we got some great feedback. Sometimes something as simple as word changing or a word that didn't really make sense. People were really good about being very specific, so that was good. I'm assuming that we're going to have an assignment to go past page 18 and review it, but I haven't heard that yet. And then there were discussions about members' feelings and understandings about MAC and BAC meetings and the agenda, how people felt about it, the topics that were covered. Should it be monthly? Should it be bi-monthly? So a lot of discussion around that, like perhaps changing the frequency of how the meetings are set up. There was talk about public participation in all the different parts of MaineCare, including the thought was you can attend a public hearing, you can submit written comments, you can contact specific staff, can also sign up for e-messages. And probably somebody else needs a little more clarity to provide a little more clarity about that. That was not really clear to me. Then we talked what we call shoot for the moon ideas. And many people had great ideas. Some of them were better understanding of complex care coordination. There was a lot of unknown about that. So that would be a request. The other shoot for the moon idea that was supported was to enhance interpreter services. There's been some complaints or misunderstandings, and people are not getting the right interpreter communication services when they call in or at their meetings. Improve wait times on the phone. That was discussed earlier in this meeting. By improving wait times on the phone, it would enhance communication. And then to also have people have a better understanding of which is the correct office for the item they want to discuss. So lots of times people will call one number and, oh, no, this isn't the organization or the person that you want to speak to. Here's the number of where you want to call. So getting some sort of clarity out there for people to know when they're calling exactly what's the correct office that they want to be connected to, and then to correctly get connected to that office. How do we meet the challenges of those who work in the day and have limited access to phone, daytime waits and conversations? That's been coming up, I guess, more and more. People are working Monday through Friday, 8 to 5 or whatever. And how do they secure an hour or 2 hours? Sometimes is what people were saying. They have to wait to get connected on the phone or to make an appointment, go in, or to go in and get a number at the at the DHHS office and sit and wait how long before you connect. So those were the shoot for the moon ideas of things that we could do to better enhance the connection for MaineCare recipients. And then the MaineCare staff noted that the OFI staffing has increased, and we did hear that earlier in today's meeting, and that they are reporting that wait times have been reduced. I think that's it. I think Kayla may have had some recommendations to some of the stuff that I just presented, but I can't get into my computer, so I'm working through my phone and my notes that I took.
No worries, Rhonda. Great job.
Thank you so much. Any questions? Okay, let's go ahead then. I'm going to pass it over to Kayla to help us shift into breakout rooms.
Thanks, Kathy. We are going to have 2 breakout rooms today. One room is going to be here in the main session. That's going to be the discussion about the changes to non-citizen coverage. Michelle will be leading us through that discussion. And then the second room is going to be a discussion about webpage content for explaining work requirements. And Vanessa DeWitt is going to lead us through that conversation. So I'm going to go ahead and open it up. You'll be able to choose which room you'd like to be in. We also welcome, I know these are hot topics. If you would like to attend both, you are allowed to switch between rooms too. So please feel welcome to do that. I'm going to go ahead and open up the room that will be for the work requirements webpage content. And you should see it pop up and be able to migrate over to that room. I'll give a 5-minute warning when we're going to be coming back. We have a little bit less time for this than we had planned. We'll have about 25 minutes total. So at the 20-minute mark, I'll give a warning. And then we'll get back here for 11:55 for some housekeeping and information about the series for next year's meetings. So feel free to hop on over. Let me know if you're not seeing it. And we can commence our breakout rooms. Great. All right. Michelle, I have the PowerPoint. I can go ahead and start sharing it if that works.
Sure. Sounds good. Thanks, Kayla.
Yeah, no problem. And I'm going to stop recording because we do not typically record our breakout room sessions. There will be notes.